Hi everyone, this is Janet Hill at the Rock Island County Health Department. It's 2:30 p.m. on August 4th. Thank you for joining us. Today we have with us Ed Rivers, the Director of the Scott County Health Department, and Nita Ludwig, the Administrator of the Rock Island County Health Department. As always, Nita, let's start off with some COVID numbers. Thank you.
Sure. So today we are reporting 8 new cases of COVID-19 in Rock Island County, and that brings our total to 1,645 cases. And our deaths do remain at 32 deaths for Rock Island County, and currently there are 15 patients hospitalized with COVID-19 in Rock Island County.
In Scott County today, the number published by our Department of Public Health is 1,597. Our deaths, unfortunately, are now at 12. Since last Thursday's press briefing, IDPH reported an additional COVID-19 related death of a Scott County resident, an elderly adult. My deepest sympathies go to this individual's family and friends. The virus continues to circulate in our community, and efforts to social distance and wear face coverings are our first line of defense to help slow the spread and protect our most vulnerable residents. Public health departments all across the nation and the world have lived and breathed COVID-19 since early this year. This means multiple months of planning for, communicating about, and responding to this novel virus that's unlike none we've seen. And in the midst of all this work, we've had to find successful ways to do all of these tasks virtually. The assessment, mobilization, communication, and investigation skills of our public health staff allow departments such as ours to respond to any and all public health threats, from flooding to COVID-19. While a public health emergency, such as a pandemic, causes public health systems to dedicate significant time and resources, at the same time, public health departments have also continued to implement broad programs and services that are foundational to public health. These include required food inspections, providing immunizations to children in our community, diagnosing and treating sexually transmitted diseases, communicable disease follow-up, animal bite investigations, maternal and child health services, and much more. These programs and services are helping protect our community from having to deal with outbreaks of childhood illness or foodborne disease while managing and recovering from the efforts of COVID-19. Public health is going to remain in the forefront as our community continues to respond to the spread of COVID-19 and into the upcoming months as developments are made in the areas of treatments and a vaccine. Know that our departments and staff are fully committed to staying the course, protecting our communities, and providing you as much information as possible to make the best decisions for yourself and for your family. While we make this commitment, we hope you will commit to taking a role in protecting our communities by doing your part. Keeping your distance when around others outside your household, and that means staying at least 6 feet apart from others when inside and outside. Wear face covering when you're out and about, not only to protect yourself from spreading the virus, should you have it, but as a great visual representation of your support for the health of our community. And stay home when you're sick. We know that's hard, but it's a very important part for what we do to limit the spread of this virus.
Okay, we'll go back to you, Nita. Do you have some talking points to share with us as well?
Sure, good afternoon, and we will be echoing very much what Scott County Health Department also does. But here, COVID-19 is taking most of our time, and we're working every day, including weekends, to keep our community as safe and informed as possible. However, our COVID-19 response isn't the only thing we are doing either. Before the pandemic started, we were working on our new strategic planning process for the next 5 years into the future. And during this process, we updated our vision and our mission statements. Both were written in January and seem kind of eerily prophetic now. But it does show that Rock Island County has always is working on behalf of our residents. So our new vision statement is Rock Island County Health Department works for the people of Rock Island and the Quad Cities to achieve health and wellness for everyone. And the mission of Rock Island County Health Department is to prevent disease, promote wellness of mind and body, and protect public health and prepare for emergencies. And all of that is certainly true now, even more than ever. You're hearing about the COVID-19 work our infectious disease department is doing every day. You probably don't know we're dealing with a nationwide salmonella outbreak that is affecting local residents as well. And sexually transmitted infections, including gonorrhea and syphilis, have been rising throughout the past couple of years. You've heard about the contact tracing that we're doing in regards to COVID-19. And to control any infectious disease, we must have widespread testing and contact tracing. And the idea of that is letting people know that they have been exposed to an infectious disease so that they can isolate and change their behavior or seek treatment if they need that. We're still giving immunizations so children will be able to attend school, and whether or not they attend school in person, they will still need the immunization requirements. We're still inspecting restaurants. We're still making sure that wells give safe drinking water and that private septic systems are working properly. So we're still inspecting all of these things and tanning beds as well, and in our environmental health department. We are still case managing children that test high for lead and making sure that help our families get the services they need. We're still feeding moms and children in our WIC program. In fact, our WIC team is working hard to transition from paper coupons to electronic swipe cards. This change is going into effect August 31st. And our clients are very excited about that. So as you can see, Rock Island County Health Department is working hard on your behalf every day. Please help us by doing your part to keep COVID-19 from spreading further by following these 3 W's. Wear your mask, watch your distance, keep at least 6 feet between yourself and others, and wash your hands frequently. When one of our contact tracers calls you, please answer the phone. We are not sharing your confidential information. We are trying to control an infectious disease that has changed every aspect of the life that we love. Please help us in doing that. Thank you so much.
Thank you, Ed and Nita, for sharing that important information on the broader picture of public health and what's still happening in the community to protect the health of our residents. And we do have a couple questions that are in the chat, so we'll go to each of you for these. First, we'll start with Ed. How are the contact tracing efforts going? Are there concerns about funding the efforts?
Well, in Scott County, we're well positioned to conduct contact tracing. We have 18 staff and a manager who are trained to conduct those investigations. During the recent surge of cases, they were very busy, continuing past normal working hours during the week and working every weekend. But since our numbers have been declining recently, they've had a chance to take a breather and catch up on that work. Since we haven't had to hire outside contact tracers, our efforts are well funded.
Nita, do you want to speak to Rock Island County's efforts?
Sure. Well, the first thing I would say is that we are getting contact tracer grant funding to help support these efforts in Rock Island County. Our infectious disease staff is normally a staff of 6 full-time employees, and they are certainly all working on contact tracing. In addition to that, we had trained 17 of our other employees in WIC, environmental health, case management, all of our other programs, so that they can help as needed if we had more cases that required extra help. But in addition to that, we have now hired 7 contact tracers to solely work on contact tracing work, and we also have a couple of volunteers that are helping us as well. And with our grant funding, we will be hiring some additional contact tracers if our cases require us to have extra help.
Next question, we'll start with you again, Ed. What are some of the suggestions and recommendations you are giving school districts as their boards decide how to hold classes?
We've been working closely with all the school districts, having regular calls as they develop their return to learn plans. We also have Dr. Ludwig, who is our medical director and infectious disease specialist, to advise them in how to craft those plans. They've all made their own decisions based on their prerogatives and their infrastructure and their ability to social distance. So we have been working very closely with them.
Go ahead, Nita, if you want to respond to the same question.
Sure. So in Illinois, every district is responsible to make their own plan. However, many of the superintendents have reached out to us, sent us their plans, asked for ideas and suggestions. So we have been busily reviewing those school plans amid all those other things that I just talked about a little bit earlier. And, you know, different size schools are going to be doing different mitigation efforts. Some are doing hybrid classes, some are completely online for the beginning of the year. But I would say everyone is taking it very seriously and trying to provide the education of all the students in the safest way possible.
Nita, just to follow up to your answer, it said, what are some of their questions? Are they related to how to handle a case when one presents in a school, or what types of guidance are they asking for?
Yeah, some of it is about if there is a case, who needs to be notified, how will that work, how will children get timely testing, and we are certainly still working on answers to some of those questions. The State Board of Education and the Illinois Department of Public Health are still drafting some further guidance tools for the schools to use, and I do believe they're coming out soon. Of course, school is starting very, very soon here on the Illinois side, so we'll be working on that in the next couple of weeks as well.
Okay, Anita, the last question here is for you. Could you address how Rock Island County and Region 2 in Illinois are doing as far as metrics and turning orange or going back to phase 3?
Sure. So we can share that in the chat box. I'll ask Janet if she can share the link to the county level metrics. And the county level metrics are things like your positivity rate, how many cases you have each week, how many ICU beds are available. There's, I think, 6 or 8 metrics in total that the state is looking at, not only as a region, but county by county as well. So Rock Island County is within Region 2 in Illinois, and that really extends from Rock Island County here all the way down to Peoria. I believe it's about a 22-county area. So as a region, the state is also looking at all of those same metrics to determine if any further mitigation efforts or strategies need to be done in specific areas, and as so not to have to go back to phase 3 or phase 2. And the governor has talked about recently there's 3 tiers, tier 1, tier 2, and tier 3. So if your county or even several counties in your region do go into that orange warning sort of level, it's really to try to figure out what is happening there, what is causing the spike, if there's a way to figure out what's happened. We know in some counties there have been issues with like sports travel teams, things like that. So could it be that you just need to work on some mitigation efforts for those particular groups, or does something broader need to be done in the whole region? So that's kind of what those metrics are used for. In Rock Island County, I will say our case counts, of course, have been higher than they have been in May and June, and so July was a relatively high month for cases. So we are in the warning zone for case counts, total case counts. However, our positivity rate has been within the target range, and our ICU beds and our other metrics. So right now we're still in the blue, but we definitely look at those every day, and we are, of course, monitoring that very closely to hopefully make sure that we don't go into the orange.
Do you want to give any final mention to how Region 2 is doing overall? That was a follow-up question.
Sure. So overall, I think it is, the metrics are posted for the week ending last week, and the region as a whole is still in the blue, which is in the target areas. There were a couple counties in our region the week before that were into some of the warning zones, but right now we're still into the blue, but those metrics do lag about a week behind. So I think they usually update them on Friday mornings every week, so I continue to monitor that and look for those.
Okay, thank you both Ed and Nita. It looks like we don't have any additional questions, so we'll go ahead and conclude the briefing for today. Thanks to our media partners. For those of you who may have received the information on the Together QC campaign that was mentioned last Thursday, you can find that information on the website as well as the downloadable PSA if you're so willing to share that for us. That can be found at www.togetherqc.com. So thank you all for your support and partnership, and we will be talking with you soon. Have a good day.